Did you know that over 92% of American households have baking soda in their kitchen, but less than 15% use it for anything other than cleaning or cooking? More than 80% of seniors are completely unaware that this simple white powder, costing just 2 cents per dose, could help support kidney function, ease arthritis, reduce heartburn, fight infections, and even improve balance and energy. One study showed that baking soda helped slow kidney disease progression by 36%. Another linked it to a 40% improvement in exercise endurance when used correctly. And yet, this kitchen miracle remains one of the most overlooked natural remedies in America. Why aren't more people talking about it? Hello and welcome to Healthy Life Keys, your trusted place for science-based, practical health tips for seniors who want to live strong, long, and pain-free. In this video, we'll uncover 13 powerful health uses for baking soda, some of which your doctor may not even mention. Plus, who should avoid it and why. If staying healthy without relying on expensive medications matters to you, hit like, tap subscribe, and share this with a friend or loved one. Let's explore what this $1 box in your pantry is truly capable of. Starting now. Detoxification, the natural reset. Baking soda, or sodium bicarbonate, is a naturally alkaline compound. When dissolved in water, it helps neutralize acids within the body. This characteristic is particularly useful in specific medical contexts such as metabolic acidosis, a condition frequently observed in individuals with chronic kidney disease, CKD. In such patients, the kidneys fail to adequately filter acid from the blood, leading to a drop in bicarbonate levels. Supplementation with baking soda has been shown in multiple studies, including a seminal paper in the Journal of the American Society of Nephrology, to slow the decline of kidney function and reduce the need for dialysis. Externally, baking soda is often added to bathwater for its soothing effect on irritated or inflamed skin. Anecdotal evidence suggests that baking soda baths can reduce symptoms of eczema, insect bites, and mild fungal infections. However, large-scale clinical trials are still lacking, and its effects should not be confused with detoxifying the entire body. Importantly, claims that baking soda can alkalize the body systemically to ward off disease are scientifically unfounded. The human body maintains a tight pH range through highly efficient buffering systems involving the lungs and kidneys. However, localized alkalinization, such as in the urinary tract or skin, can have therapeutic benefits. But baking soda's benefits go far beyond skin deep. Let's now explore how it plays a surprisingly active role in maintaining a bright, healthy smile. 2. Teeth, whitening, and oral health. A brighter smile. Naturally, baking soda's value in oral care dates back over a century. It acts as a mild abrasive that physically removes surface stains from tooth enamel without causing significant erosion when used properly. Furthermore, its alkaline nature neutralizes acids in the oral cavity, helping to restore an optimal pH balance and inhibit acid-loving bacteria such as Streptococcus mutans, a major contributor to dental caries. A clinical study published in the Journal of Clinical Dentistry found that toothpaste formulations containing baking soda were significantly more effective at removing plaque and whitening teeth than non-bicarbonate alternatives. Another study demonstrated reduced bacterial count and improved gum health following consistent use. However, the American Dental Association warns against frequent overuse, as aggressive brushing with baking soda can erode enamel over time. Dentists recommend limiting direct baking soda use to 2 to 3 times per week, using a soft bristled brush and avoiding excessive pressure. While we're on the subject of acids and bases, let's turn to a common digestive issue that plagues millions: heartburn. 3. Relief from heartburn. Quick, natural comfort. Heartburn is commonly triggered by the reflux of stomach acid into the esophagus, often after heavy meals, spicy foods, or due to gastroesophageal reflux disease, GERD. The discomfort can be intense and persistent. Sodium bicarbonate, as an antacid, offers immediate symptomatic relief by neutralizing gastric hydrochloric acid. According to a review in gastroenterology and hepatology, sodium bicarbonate has been used for decades as a quick response, over-the-counter remedy for occasional heartburn. Its mechanism is straightforward. Bicarbonate ions bind with hydrogen ions from stomach acid to form water and carbon dioxide, temporarily elevating gastric pH. However, caution is warranted. Chronic or high-dose use can lead to systemic alkalosis, especially in individuals with compromised kidney function. It may also cause rebound hyperacidity, where the stomach produces more acid to compensate for the sudden pH change. While it's effective for acid indigestion, baking soda's protective properties also extend to your skin, particularly in the battle against fungi. 4. Antifungal properties, a natural warrior for your skin. Fungal infections, including athlete's foot, jock itch, and candidiasis, thrive in warm, moist, acidic environments. Baking soda alters the local pH, creating conditions that inhibit fungal growth. It also has mild drying properties that reduce moisture, a key contributing factor to fungal proliferation. A study published in Mycopathologia tested various fungal strains against sodium bicarbonate solutions and found that over 80% showed inhibited growth. Topical applications, whether in the form of pastes or soaks, have shown benefit, especially when used as adjuncts to antifungal medications. In practice, adding 2 to 3 tablespoons of baking soda to warm water and soaking the affected area for 15 to 20 minutes daily can reduce symptoms. It is also safe to combine with essential oils like tea tree oil for enhanced antifungal effects. Moving from external invaders to internal irritation, let's look at how baking soda may assist with urinary tract health. 5. Relief from urinary tract infections. Support from within. UTIs are especially common in older adults and postmenopausal women. They result from bacterial invasion of the urinary tract, often accompanied by painful urination, urgency, and lower abdominal discomfort. While antibiotics remain the cornerstone of UTI treatment, baking soda may serve as a supportive remedy. When consumed in small quantities, e.g., 1/2 teaspoon dissolved in 8 ounces of water, it can raise urinary pH, creating a less hospitable environment for bacteria like E. coli. A clinical observation in the Japanese Journal of Urology reported symptom relief in women with recurrent UTIs who used baking soda supplementation. However, this approach is palliative, not curative. It's especially contraindicated in patients with renal impairment, and long-term use can lead to electrolyte imbalances. From urinary discomfort, we move to a smaller, yet surprisingly painful issue: canker sores. 6. Healing canker sores. Gentle relief for mouth pain. Aphthous ulcers, or canker sores, are benign but painful lesions inside the mouth. They are often triggered by stress, trauma, or food sensitivities. Their acidic environment prolongs inflammation and pain. Baking soda's antiseptic and pH-modulating effects can reduce inflammation and speed up healing. A randomized clinical trial published in the Journal of the American Dental Association found that baking soda mouth rinses led to faster resolution of symptoms in patients with recurrent ulcers. To use, dissolve 1/2 teaspoon in a glass of warm water and rinse for 30 seconds, up to 3 times a day. Baking soda is preferable to many over-the-counter rinses for those with sensitivities to alcohol or synthetic ingredients. But the benefits of baking soda aren't limited to healing. They also extend to enhancing physical performance. 7. Boosting exercise performance, fueling your potential. During high-intensity exercise, anaerobic metabolism produces lactic acid, lowering muscle pH and leading to fatigue. Sodium bicarbonate acts as an extracellular buffer, helping delay the onset of muscle fatigue by neutralizing excess hydrogen ions. A meta-analysis in the Journal of Strength and Conditioning Research demonstrated that sodium bicarbonate supplementation improved performance in sprinting, swimming, and other anaerobic efforts. The standard dosage is around 0.3 grams per kilogram of body weight, taken 60 to 90 minutes prior to exercise. However, gastrointestinal distress is a common side effect. Many athletes use enteric-coated tablets or split the dose to improve tolerance. From the muscles we use to move, let's look at the organs that keep our blood clean. The kidneys. 8. Supporting kidney function, a gentle guardian. CKD affects nearly 10% of the global population. One silent progression factor is chronic low-grade acidosis, which accelerates nephron loss and bone demineralization. In a 2009 study in the Journal of the American Society of Nephrology, patients with stage 4 CKD taking daily sodium bicarbonate supplements had slower declines in glomerular filtration rate and reduced markers of bone turnover. Bicarbonate supplementation also improved nutritional markers and physical function. Clinical guidelines now cautiously support its use under nephrology supervision. Sodium content remains a concern for patients with hypertension or heart failure. From the kidneys, let's turn to a disease marked by systemic inflammation, arthritis. 9. Easing arthritis. Symptoms: a natural anti-inflammatory. Chronic inflammatory diseases, like rheumatoid arthritis, are marked by immune system dysregulation. A 2018 study in the Journal of Immunology found that baking soda ingestion affected mesothelial cell signaling in the spleen and peritoneum, shifting immune response from pro-inflammatory to anti-inflammatory states. This change was mediated by a shift in macrophage polarization, increasing M2 anti-inflammatory markers while suppressing M1 pro-inflammatory ones. While more research is needed, early findings suggest that baking soda may act as a low-cost immunomodulator. This same alkalizing potential could also be beneficial in managing gout, another painful joint disorder. 10. Managing gout, lowering uric acid. Naturally, gout results from uric acid crystal deposition in joints, often exacerbated by acidic urine. Sodium bicarbonate raises urinary pH, enhancing uric acid solubility and excretion. Although primarily anecdotal, some patients report fewer flare-ups when using baking soda. Scientific support includes in vitro models demonstrating bicarbonate's effect on urate solubility. However, this should never replace medications like allopurinol or febuxostat. Sodium intake must also be monitored in gout patients with concurrent hypertension. Let's move from joints to the respiratory system and how baking soda can help during seasonal illness. 11th. Soothing cold and flu symptoms. a natural respiratory aid. During upper respiratory infections, thick mucus and throat inflammation make breathing and swallowing difficult. Baking soda, when added to saline solutions, enhances mucus dissolution and soothes irritated mucous membranes. Gargling with 1/2 teaspoon in warm water helps reduce microbial presence and soothe sore throats. The Journal of the American Dental Association reports that regular baking soda rinses reduce bacterial load and inflammation. It can also be used in neti pot solutions to flush nasal passages, always using sterilized water to prevent infections. From viruses to perhaps the most feared diagnosis, cancer. What role, if any, does baking soda play? 12th, adjunct role in cancer therapy, early but promising. Emerging research suggests that tumor microenvironments tend to be acidic, which promotes cancer cell invasion and therapy resistance. Animal studies show that systemic alkalinization via sodium bicarbonate can increase tumor pH and improve chemotherapy outcomes. In a 2009 study in Cancer Research, sodium bicarbonate administration in mice with metastatic breast cancer reduced the formation of spontaneous metastases and increased the efficacy of doxorubicin. Human trials are underway, but no clinical protocols currently endorse its use outside of research. Always consult an oncologist before considering such interventions. Lastly, let's explore how baking soda can help with daily hygiene naturally. 13. Natural deodorant. Freshness without toxins. Baking soda neutralizes the acidic components of sweat, inhibiting the growth of odor-causing bacteria. Unlike commercial deodorants, it contains no aluminum, parabens, or artificial fragrances. A study in the Journal of Cosmetic Dermatology found that sodium bicarbonate applications significantly reduced axillary odor in volunteers. For best results, apply a small amount to clean underarms or mix with coconut oil for a moisturizing blend. Some users may develop irritation, especially with shaving. Always perform a patch test before routine use. With such a broad array of applications, baking soda proves itself to be more than just a pantry staple. It's a versatile tool for everyday health challenges. Who would have thought that something as simple as baking soda, a humble everyday item, could hold so many secrets to better health? Today, we uncovered 13 remarkable ways this low-cost powder can support your kidneys, reduce inflammation, relieve pain, fight infection, and even sharpen your strength and stamina after 60. It's a powerful reminder that sometimes the most effective remedies aren't hidden in a bottle. They're already in your home. But remember, not every remedy is for everyone. Always speak with your doctor before making changes to your health routine. Here at Healthy Life Keys, our mission is to help you age with clarity, confidence, and control, naturally, wisely, and without overwhelm. Thank you for choosing to spend your time with us. If today's video helped you learn something new, inspired you, or simply made you feel more hopeful, please like, subscribe, and share it with someone you care about. Because real health isn't just about adding years to your life, it's about adding life to your years. We'll see you in the next video. Until then, take good care and stay vibrant.